It's no secret that hospital stays are getting shorter, and you might be a person who believes that means you're not getting the quality care and attention that you need. Not so. Hospitals are rushing patients out the door, but not for the reason you might think. I'm your host, Rachel Bozing. Welcome to My County, the show that explores services and programs provided to you by Los Angeles County. Joining me today is Dr. Brad Spellberg, Associate Professor of Medicine at Harbor-UCLA Medical Center, and also the author of Rising Plague. Now, we're talking about hospitals rushing patients out the door, and they are, and why is that?
Well, you know, there's an old saying amongst physicians that the longer they stay, the longer they stay. And what we mean by that is patients come into the hospital with problem A, B, or C, and while they're in the hospital, they pick up an infection, and the next thing you know, their 1-day or 2-day hospital stay turns into a week or a month. So the desire is to get people out of the hospital before they get a complication of being in the hospital.
So the stats in 2002, which is the most recent statistic we can find, said that 2 million people acquired infections while in the hospital and 100,000 of those died. Why is it that the bugs that you get in a hospital are so potent?
Well, you know, hospitals, you're concentrating the sickest people together in the same place, and there's lots of antibiotics being used, and so you basically are breeding these superbugs that are resistant to our antibiotics. And so the bacteria you encounter in the hospital are a lot nastier than the stuff you're going to pick up at home.
Because, like you said, the hospital has all the antibiotics around it, so they're just kind of maneuvering around it.
Yeah, I mean, the bacteria are simply adapting to the antibiotics they get exposed to and evolving to become resistant to those antibiotics.
Do we have bacteria in hospitals right now today that we aren't able to treat?
Yes, unfortunately, we are starting to see globally across the world and in the United States bacteria that are resistant to every antibiotic we have available to us.
And does that make you scared? Do you go to bed scared?
I go to bed really worried. I go to bed worried about, you know, what am I going to do the next time I see one of these infections, and I don't have anything left to use against it. And I also go to bed worried because I know that these infections are increasing in frequency each year. So what's the situation going to be like 5 to 10 years from now when we're seeing these kinds of things on a daily basis?
The other issue that you've brought up is that drug companies, they're kind of fleeing this area of medicine. Tell me about that.
Yeah, I really talk about the lack of antibiotic development in this book, Rising Plague, and there's 2 big reasons why antibiotic development is basically dying. The first is economic, and the second is regulatory at the level of the FDA. The biggest economic problem is, you know, when a company sells an antibiotic, you take it for 7 days and then you stop because you're cured, right?
Right.
Well, a company's going to make a lot more money selling a drug you're going to take every day for the rest of your life, like a blood pressure drug or a cholesterol drug or an arthritis drug, than they are a drug you're going to take for 7 days and then stop. So guess which type of drugs these companies all want to develop now, and they don't really want to develop antibiotics anymore. The second problem is that even the small number of antibiotics that are getting developed, they're making their way to the FDA, and because of a variety of arcane changes in the way the FDA works, the FDA is now saying, well, we don't want to approve these drugs anymore. And so companies can't get their drugs approved once they develop them.
And in terms of these superbugs, they're seen more in developed countries as opposed to undeveloped countries. Why is that?
Yeah, these superbugs, these infections you get in the hospital, are side effects of modern medical therapy. You know, when you come in the hospital, we do a bunch of intensive care things if you've got a bad medical problem. We'll put a plastic tube in your vein to give you medications. If you can't breathe, we'll put a tube down your throat to breathe for you. Those things allow bacteria easy access to your body.
Right.
You know, before they had to fight through the skin. Now you got a direct conduit into your bloodstream. So we do a bunch of things to keep you alive when you got a bad medical problem. Those things have side effects, and the biggest side effect is it allows infections to occur.
So we have a situation where superbugs are on the rise, and drugs, the antibiotics, or drug companies are not making them as frequently. What do you propose? What's the average person to do?
Well, you know, I talk about my book. One of the biggest things is that we need to educate the public about this problem, and you know that might help politicians to fix the problem. But in terms of what individual people can do, number one is wash your hands.
Yay.
I know it sounds really mundane and easy, but that is actually the best way to prevent exposure to these bacteria and getting them on and in your body. So regular hand washing is the biggest hygiene thing you can do. The second thing is lead a healthy lifestyle. Exercise, diet, basic safety precautions. When you're in a car, wear a seatbelt so that when you get into the car accident, you don't end up in the ICU with a head injury, you end up in the ER with a minor scrape. You know, if you live a healthy lifestyle, it'll keep you out of the hospital.
Right.
And then the third thing is if you have to go into the hospital, work with your doctors, work with your nurses and your social workers to try to shorten your stay as much as possible. Try to get out of there as fast as you can so that you don't have time to pick up one of these infections.
And we've come full circle. Get out of the hospital yourself. This is where you as a person, on your own behalf, you should get out as quickly as possible.
Right.
And before we leave, I do want to touch upon the 10 by 20. Tell me what that is and what that means.
Well, there's a national organization called the Infectious Diseases Society of America, which is aware of the antibiotic crisis and is desperately trying to fix the problem. And so they've come up with this new initiative. 10 by 20 means we want 10 new antibiotics by the year 2020. And this initiative is calling for people at every level, the President, the House, the Senate, venture capitalists, companies, philanthropists, universities. Everybody needs to come to the table to try to fix the problem.
Wow. Well, and we hope that they actually respond because we all are dependent upon that. Because very briefly, if this isn't responded to, what do you envision?
Well, you know, if we do nothing, these infections that we see that we can't treat are going to increase in frequency. And you know, we're basically going to regress back to like 1934, you know, back 70 years, set back medicine 70 years to an era where you'd get a simple skin infection and you drop dead from the infection because we had nothing we could do to treat you with.
Right.
So we're talking about an increasing, just a daily experience of seeing untreatable infections if we don't develop some new antibiotics.
So that means that we all have to start washing our hands, living healthy lifestyles, and advocate for yourself and get out of the hospital as quickly as you can.
Absolutely.
Thanks so much, Brad. I really appreciate your time.
Thank you.
And please join us next time right here on My County and learn about more programs and services brought to you by Los Angeles County.